Well, it's 7 o'clock, so we're going to get started. I'm going to call the meeting to order. Al,
Recording in progress.
Al, you can hear us all right?
Yep.
Okay, good. The first item on the agenda is a roll call. Ms. Jane?
Osberger. Berthelot.
Here.
Bruder.
Here.
Coleman.
Here.
Cotton.
Here.
Frattoni.
Here.
Moran. Jurin.
Here.
Shaken.
Here.
Thank
And
you.
Mayor Moran is enjoying a well-deserved period of time off. She's somewhere in the Caribbean right now, and she'll be back with us at our next meeting. The first item on our agenda after the roll call is the opportunity for the public to address the council. We have some folks, so just quick ground rules. You get 5 minutes, and please state your name and address, and please be civil. So yeah, Lon, come on up.
My color printer only prints a few at a time, so. So good evening. My name is Lon Hultgren. I live at 404 Woodland Road in Storrs, Mansfield. And I'm here tonight as a member of Bike Mansfield, and we've got a couple other people here as well. And we've written up a little letter, which you'll receive shortly. Basically, we're a little, at our last couple of meetings, we found out that the town and state are planning to put a signal at Separatist Road and South Eagleville Road. And we're a little worried about that. Some of us more than others. But we really are pro-roundabout. And what we wanted to do, or what I would like to do, is just underscore how we think that a roundabout at Separatist Road and then another one at Maple Road would just absolutely make a tremendous difference on the speed of traffic that then proceeds along the straight stretch of 275, which, as we know, is quite dangerous and would really serve as a gateway, if you will, coming into the urban area. And so, while we understand that the signal has been approved by the traffic authority and so on, we just want to make sure we don't lose sight, the town doesn't lose sight of the beneficial effect of a roundabout at that intersection. And so that's basically my message for tonight as a member of Bike Mansfield. And we, as I said, we have a couple other people who want to underscore that in their own way. So thank you.
Thank you. Come on up.
Hi, my name is David Palmer, and I live at 505 Alder Lane in Storrs, and that's the Juniper Hills Village Community, and I'm also on the executive committee of the Juniper Hill JHV Residents Group. And for a long time, we've been concerned about the Maple Hill, South Eagleville intersection. It's a dangerous one, especially with failing eyesight, and we feel like a roundabout would be a far better way to manage the traffic coming through. And likewise, at the Separatist intersection, where it's already been evidently approved for a signal, that's a senior living community as well. And safety is our primary concern. And the ability of roundabouts to calm the traffic, especially in those two, intersections which are right next door to each other, would really make a difference and also save you a bundle in the number of signs that get knocked over every year in the island on Maple Road, where the students or somebody runs over those signs, because the turn is a very difficult turn to make. There's a curve right approaching it, and it's a very tough left-hand turn going into there. So a roundabout would, I know it hasn't even been talked about perhaps in terms of that intersection, but that combination would suit our needs wonderfully. Thank you for your time.
Thank you. Anyone else? Seeing none, then I will, is there anyone else for public comment? Rahan, come on up. Here, nope, you got to sit at the table and speak in the microphone so we can hear you on the recording. And name and address, and you get 5 minutes.
I won't need 5 minutes. My name is Ron Menizza. I live at 456 Bassett Road, Mansfield Center. And I am here to talk about the traffic light concern that is being proposed for the end of Separatist Road on 275. And my concerns are, I am not just a resident of this town, but I'm also a strong advocate for cycling. I have a now 5.5-year running radio show and podcast out of WHUS called Bicycle Talk. And my concern is that putting a traffic light in that intersection is going to increase fatalities on that road, which we've already had one there this year. And it's just the wrong direction to go. And a roundabout is a far safer way of doing it. More and more towns across the country are going towards roundabouts. There's even a town out in Indiana has put all the traffic lights out and put in only roundabouts. The fatality rate went down 87%. So it's not just pedestrians and cyclists that have a problem with a four-way intersection with a traffic light. It's also automobiles that are running red lights, and it's a key concern. It's a major concern as far as fatalities go. I think that because we are so associated with the University of Connecticut and the campus and the number of people that ride and walk in this area, we really need to be a little more progressive about that particular intersection. I'd personally like to see another one up at Maple Road and another one up at Eastwood, because Eastwood was the place where the student was killed back in January. We're just creating a very car-centric society, which is not going to go over well with the increase of students and the population and the number of pedestrians and cyclists in the area. That's it.
Thank you. Is there anyone else? If not, I will declare public comment closed. And we will move on. Thank you all for coming tonight. The next item on our agenda is the report of the town manager. Ryan?
Thank you, Mr. Shaken. Council obviously is well aware that November 8th, we have an election coming up. And on behalf of the registrars of voters and our IT department and kind of everybody involved, I just wanted to pass along some words of assurance that, because as I understand it, predated me, but I understand 2018 was kind of a low light in terms of elections here in town. There were a number of things that went wrong, Wi-Fi crashing and how that impeded the work of the election workers and other things in terms of, just sort of kind of traffic management, I guess you could say. And so I think they have some new protocols and systems and sort of human beings, frankly, in place to help avoid a repeat of that. So there's going to be a lot more staffing, particularly here for the EDR piece of what's going on, as well as upgrades in IT systems and hardwiring of computers that previously relied on Wi-Fi for the election workers. And also, from my standpoint as town manager, we haven't finalized the game plan yet, but there's likely going to be some expanded use of remote work authorization, that employees that don't have to be in this building can work from home. And we may be deploying, if needed, some staff that normally work on other things in this building to help support the election. But I think there's added staffing and IT systems and other practices that are going to be in place that will hopefully help things go smoothly this election cycle. On the general topic of elections and our elected officials, I wanted to say that I have opened up lines of communication, or will be opening up lines of communication with our state legislative delegation to schedule a meeting of the minds after the election. In particular, we are going to be looking at at least a portion of the town, new state representation, and so want to make sure that they're aware of various town projects that are high priority right now, and hopefully garner their support for different grants and the like that we'll be pursuing in the future. So looking forward to having those discussions with our state legislators after the people have spoken, as it were. Council obviously will remember that in September we had a presentation, or you all received a presentation from TSKP Studios talking about the first phase of the municipal facilities needs assessment work that was done, and I just wanted to provide the council with a little bit of an interim update that work continues on the refinement of a scope for the second phase of that work. There'll be a particular focus on the front end of phase 2, if you will, on the public engagement and community involvement piece of all that. It's critically important that we have a very robust public engagement process, and that the findings or the alternatives, things that have been looked at in phase 1 are shared far and wide with our citizenry, and that we get a really diverse cross-section of our population to kind of weigh in and give us a sense of what they like, what they don't like about what's being discussed, and what we might need to tweak in terms of some of the things that we're looking at. So stay tuned. I expect, or I'm hopeful that the first meeting in November we'll be able to go before the council with a more detailed conceptual scope of work for the next phase of that important project. Just a couple words on the new elementary school project. Obviously, council received a detailed overview of things at the most recent council meeting. For my part, I just want to report that I and others continue to engage in regular meetings with Newfield Construction and the construction team, as it were. And unfortunately, we still are not at a point where we've identified a definitive, achievable date that the building will be completed and that school can start. We continue to press for that. We understand that there are outstanding procurement issues, and there are a number of critical work items that are still incomplete and being tracked. But we actually just had another meeting with the Newfield Management Group today, and we still do not have answers to questions about schedule that are really critical. So I will continue to keep the council fully abreast, and obviously encourage anybody who has time and interest in doing so to follow the deliberations of the school building committee, where a lot of these discussions are playing out in a real-time fashion. I want to let the council know that the Planning and Zoning Commission is planning to hold a public hearing on December 5th to hear comments on draft regulations for cannabis establishments. And along those lines, we're also looking at, for the November 14th council meeting, providing a presentation to council as it pertains to both the results of the community survey that was done on cannabis and the draft regulations that have been developed at this point. It'll be the subject of the public hearing. Just a few more notes. I want to make sure the council is aware that effective November 1st, we're instituting some slight tweaks to our approach to community center memberships. In particular, we're including for the first time a month-to-month option, so no annual contract requirement. Based on our research, we found that this is very common, not just in the private sector, but also for municipal community centers and wellness centers, to avoid some of the concerns people have about locking in for a full year. So we'll still offer a full year, and that'll be at the most, cost-competitive option. So there will be a savings if you do a year's membership, but you'll be able to do a month-to-month membership if you're at all concerned about your ability to use the facility for for a full year. And I think in the interest of time, I will conclude the verbal portion of my report there and field any questions the council may have.
Questions?
Exciting to be hiring a new director of human services. In reading it, I see that the requirement is for an LMSW rather than an LCMSW. Is that intentional?
That was intentional. That was, I guess, the outcome of deliberations between our HR folks as well as the guidance of Human Services, the current Human Services Director, and we talked about the nature of the work and the services that we provide, and basically that we are not providing both the nature of this, I guess, emphasis on the nature of this position does not require the clinical services background because they will not be providing those services. And it was also felt that the applicant pool, when we look at comparable job descriptions that are out there right now or have been recruitments that have happened recently, that level, I mean, certainly it would be welcome if an applicant had that, but we thought it was just simply too limiting for a position that would not actually be a clinical practitioner.
And my second question has to do with the outreach for community input regarding the facilities study. How are we conducting that outreach?
Well, so we haven't for the
I
municipal
did
facilities.
misunderstand the.
Yeah, so we're working on a scope right now, which will detail what the community engagement process will be. So we have not launched it yet. We are working with a prospective firm that operates in this space. Probably it'll still be a competitively, bid scope of work. So we're working with a professional firm that may have an interest in bidding, but will be a competitive bid process. So they may not get the bid, but they're helping us kind of organize our thoughts. But we haven't started that yet, and we're just basically trying to figure out what the full scope of the work will be, because we envision it being really in-depth, multimodal, if you will. Combination of digital means, in-person meetings, all sorts of different things. We want to make sure that all our demographics that we're hitting, that those members of our population, our residents that are, I guess you just call them harder to reach, that we find ways to get through and give them an opportunity to provide their input. So it's still in the construction phase in terms of developing that scope.
Thanks. Anybody else? Mr. Coleman?
Thanks, Ryan, for your report. Back to the elementary school project, what do you consider critical issues? In your report, you refer to critical issues.
So there are a number of items that are laid out in terms of both site and exterior, general building, flooring, mechanical. So I don't know that I can say anything, Mr. Coleman, that's really beyond, we're still waiting on, as an example, there's an issue with the generator. We're trying to figure out if there's a way to have a temporary generator in place, because that's a public safety necessity to have the building have a backup source of power. So if we lose power, that generator obviously will pick up where that left off. And I know you attend some of the school building committee meetings, so there's still outstanding issues with the flooring being resolved and a number of other things that are certainly critical. They're going to prevent occupancy until they're resolved.
Okay. On the flooring issue, you state that a successful adhesion test was conducted with the removal of a thin top layer of the concrete surface. And then on the bottom, you go on to say the flooring work is crucial to completion of individual spaces with the building. Although there are multiple weeks of flooring ahead, the largest risk to the schedule, the uncertainty of the preparation method, is now complete. Didn't the town in the last meeting request concrete testing in that regard? Are we changing our minds on that, or did I get that wrong? I think the October 13th school building committee, we requested to have some concrete testing done on the slabs.
Well, if you're talking about like core samples of the slab. There have been, as I understand it, pretty extensive core sampling done. The structural integrity of the slab is not in question. It really is just a matter of the sort of surface treatment and ensuring that the flooring can bond appropriately to the surface of the concrete. But long before the concerns about the adhesion and the quote-unquote pull test fails that happened, core samples of the concrete were taken, and at this point, there's no concerns about the structural integrity of the concrete. This is not a crumbling concrete, crumbling foundation situation. It's just a matter of the actual superficial nature of the.
So did I get it wrong in the last meeting? What were I thought the town was going to do an independent test.
Well, I think you're referring to, and I think this would be a good topic of discussion at the next school building committee meeting, so you can hear directly from, the subject matter experts. But I think the independent testing you're talking about is, as it relates to independently verifying that it'll pass the pull test, so the actual, that the bonding will pass, and independently verifying that, not the actual structural integrity of the concrete.
Okay, so if we're doing the core tests, and the core tests take 4 to 6 weeks to come back, correct?
Well, again, not core tests.
Or the tests that that were requested in the SBC?
Yeah, I don't have the schedule
Yeah.
in front of me, but I think that
Okay.
timeframe sounds about right.
And now, what are we looking for, really? Just that top layer, or are we making sure that everything is okay all the way down in the slab?
Yeah, I mean, there's a number of variables involved, and again, I think that rather than kind of off the cuff have this discussion here, I really think it should happen in a school building committee
Okay.
meeting.
Also, in your report, you state that, and I found this, that I think we should have been notified that Charmaine Bradshaw Hill is on leave. and
Brian,
our-
we're going to have a conversation in executive session. I'd like you to keep your questions to that conversation.
Okay, yeah, I'll wait for executive session.
Thanks.
Thank you, Deputy Mayor. Also, the building facilities study, we're employing TSKP Studios in that?
We employed TSKP Studios on the first phase of the work.
Perhaps we ought to see how TSKP Studios pans out for us with the school before we ask them to do anything else for us. That's just my personal opinion. Thank you.
Anything else from counselors? Not, we will move on. The next item on the agenda is reports and comments of council members. Does anyone have oh, was that a hand? Coleman, go ahead.
In our last meeting, October 11th, we had a proclamation in honor of Quentin Kessel, and I think it was a disservice that we did not read that proclamation and recognize a citizen who has served us for 50 years. I would like to read that proclamation here and now. Whereas Quentin Kessel began his service as a member of the Mansfield Conservation Commission in 1972 and served on the commission for 50 years until the present. As well, he served as a Conservation Commission liaison to Open Space Preservation Committee from 1994 to 2018, and as a liaison to subsequent Parks and Natural Resource Committee from 2018 until the present. And whereas Dr. Kessel's service and leadership have been instrumental in the establishment and growth of Mansfield Conservation Commission, to which has generously contributed his historical knowledge, keen insight, thoughtful skepticism, and good humor. Whereas, excuse me, I lost my place. Whereas Dr. Kessel has provided valued feedback in his review of applications for Inland Wetlands Agency and Planning and Zoning Commission, from his commitment to attending site visits to his questions of applicants and his participation in Conservation Commission discussions on the merits of application. And whereas Dr. Kessel has advocated for and been involved directly in the permanent preservation of many of Mansfield's treasured parks and open spaces. Whereas Dr. Kessel has served both as a volunteer and in his personal life as a model of the conservation and stewardship of our natural resources. That is the foundation of the Commission's charge, and whereas, through a lifetime of commitment to his community as a professor, coach, and community volunteer and commission member, Dr. Kessel has contributed greatly to what makes Mansfield a wonderful place to work, live, and raise a family. Now, therefore, be it resolved that we, the town of Mansfield, the Mansfield Town Council, together with the Conservation Commission, on behalf of the citizens of Mansfield, do hereby commend and thank Quentin for his long and distinguished service to the Commission and the town of Mansfield. We hope that you are able to transition into a life of relaxation and tranquility on Wednesday evenings. Thank you.
Thank you. Any other reports? I will just offer one briefly, which is to have asked the council to take a quick moment to acknowledge the tragedy in Bristol over the last week with the killing of 2 police officers there. I think it's just important that we acknowledge it, given that every community in the state asks law enforcement to do a dangerous job every day. And as much as this is a personal tragedy, it's also a tragedy in municipal government in one of our sister towns and cities in the state. And so I just asked the council to observe a brief moment of silence in honor of Lieutenant Dustin DeMonte and Sergeant Alex Hamzy. Thank you. The next item on our agenda is our consent agenda. There's 2 items on it, last meeting's minutes, and a agenda item from the Committee on Committees. Anyone wish to pull anything off of the consent agenda, Mr. Coleman?
No, I was just going to move to,
Okay.
I want to make one minor change on the minutes. Does that mean having to pull it off the consent agenda to do that, or?
What is the change?
It's minor. It's under D, ARPA funding for social service agencies process review. It says Ms. Berthelot expressed her approval and asked that this 501c3 requirement be clearer and the economic insecurity be defined to include daycares. Just a slight difference, rather than indicating that I was asking that that daycares be included, instead that I was inquiring as to why they were not included. And daycare / early childhood development center, rather than just raised daycare.
Do you have that, Ms. Shane? Okay. I'm okay adopting the minutes through the consent agenda with that technical correction. Mr. Coleman, do you want to move acceptance?
yeah, I would like to move to adopt the consent agenda.
Seconded by Mr. Bruder. Is there any discussion? All right. All in favor, raise your hand. Passes unanimously. Great. The next item on our agenda is old business, and we will start with item A, an update on the federal local bridge program. Mr. Ellsworth?
So while our acting Director of Public Works, Derek DeLay, gets comfortable in the guest seat, I'll just briefly tee this up for him. So the council, at its September 12th meeting, I believe it was, authorized the town to submit applications for funding under the federal local bridge program. We submitted application for funding for 4 bridges. We received a commitment to fund 3 of the 4 projects last week. That's very exciting news. The cumulative amount of the project cost is projected to be about $14 million, and this is 100% covered. Again, 100% covered by the grant program. Typically, under this program, there would be a 20% local match or non-federal requirement, but under the enhanced funding streams through the bipartisan infrastructure law, this program is fully funding, so 100% of the project cost. And I'll turn it over to Derek to provide a kind of a flyover of these 3 projects and what they mean for our community.
Certainly. So we had 3 of the 4, obviously, were identified with a commitment to fund. We're still following up with the DOT to find out what happened to the 4th one. So I don't have an update on that, on the 4th bridge at this time. But we do have 3 bridges. One would be Atwoodville Road over the Mount Hope River. Another is the Gurleyville Road over the Fenton River. and Juniper Lane over the Mount Hope. There will be some scheduling components to this because obviously one has a definite impact on the other in terms of circulation of traffic. But it's a very exciting program, and so far so good, and we're looking forward to getting started with it. It is a design managed by state, so it really uses the state as the primary designer, which definitely speeds up the process quite a bit. We're just looking forward to getting started on the projects if the council wants to support each of the motions.
Any questions from councilors? Mr. Sharon?
Yeah, maybe here. What's the longest period of time that traffic would have to be diverted in any of these cases?
It really depends. Some of them will be a temporary structure. It really depends on a lot of the permitting components. If there's a reasonable detour, especially, I mean, the one I really see the most of is Gurleyville Road, which handles quite a bit of traffic. Really, the detour at that point in time would either be Chafeeville Road or it would be Stone Mill, which is not a great detour. So there would definitely be a lot of reach out and a lot of expectation that we'd try to use Chafeeville because that tends to speed up construction by able to close it. You may not necessarily have to, but it definitely speeds up construction and kind of minimizes those impacts to, to the stream flows.
Just, are you thinking of a year, a month?
Decade? Probably about 6 months
Okay.
of active construction.
Mr. Bruder?
Yes, thank you. One thing in there, Packet, Atwood Road, I think it's supposed to be Atwoodville on the agenda. But for the Atwoodville and the Juniper Lane, I know that you can go around by doing it that way. You're not going to do both at the same time, I would
Absolutely
imagine.
not.
Okay.
And question for me, and there was someone else, is the Atwoodville Bridge probably the most complicated and substantial one from a construction perspective? It's very tall.
I would say Gurleyville and Atwoodville, or Atwoodville and Gurleyville both have their own complexities.
Other questions?
Yeah, I have one.
Go ahead, Mr. Coleman.
So you're saying, are we going to be doing all these bridges at the same time?
No, not all concurrently. So one would be constructed first, then the next one. So as an
Okay.
example, Atwoodville would be constructed ahead of Gurleyville Road, and then
Okay.
Gurleyville Road, and then,
So you're talking a couple of years?
yes.
Okay, thank you.
One final question for me. I think you said it, but I spaced out for a second. What's the fourth bridge that hasn't been approved yet? Certainly. It's Old Turnpike Road over the Fenton River. Got it. All right, well, if there aren't any other questions, there are 3 motions on page 14. I'm happy to consider them together unless folks want to split the question. Mr. Bruder?
I'd be happy to make all 3 at the same time. Move effective October 24th, 2022 to authorize Town Manager Ryan J. Ellsworth to sign the commitment to fund letters for bridge number 04729,
Just read all the numbers. And
as well as bridge number 04730, as well as bridge number 05353.
is there a second? Second by Mr. Coleman. Is there any discussion, Mr. Bruder, in support of your motion?
I hope we all pass this.
Any other discussion? All right, let's vote. All in favor, raise your hands. Passes unanimously. Thank you. The next item on our agenda is we will be joined again, been a while, by Rob Miller from the Eastern Highlands Health District to give us a COVID-19 update first under old business and then to move on to new business and hear from him
Thanks.
with an annual department update from the Health District. So, welcome back, Mr.
Good evening,
Miller.
Deputy Mayor Schenken. How are you doing?
Well, how are you?
I'm well, thanks. And good evening to the rest of the councilors. Pleasure to be here tonight. Let me see if I can get my slides up. Yeah, no, go ahead. Let's throw them. These slides are essentially an outline. You can leave it right there. It's going to cover the topics that I'm going to speak to tonight. As
Deputy Mayor indicated, it's been some time since I've been here last to talk about COVID-19. I think it was March, in fact, since the last time I was here. And a lot has happened since then. But suffice to say that the demand on Eastern Highlands Health District's resources have materially waned since that period of time. While we're still very much involved with the response to COVID-19, we had really put a number of things on pause for the prior 2 years. So you can imagine that we're now trying to catch up on 2 years worth of work that we otherwise weren't able to do due to this response. But the bulk of our activities to date are focused around the vaccination program. We've done 13,400 vaccinations since December of 2020. We're conducting about 10 clinics a week. We've got regular clinic hours here in the town hall on Mondays and Thursdays. And then we're doing about an additional 2 to 3 pop-up clinics on any given month, depending on what's going on around the health district. We're providing all of the vaccine formulations that are on the market, with the exception of Johnson & Johnson. That has been put aside, but we are providing the new Novavax primary shot, and we're also providing the new bivalent formulations that provided by Moderna and Pfizer. What we aren't doing, unfortunately, is vaccinating kids under the age of 5. We just don't have the pediatric clinical staff capacity to do that, but we are making the appropriate referrals when we get those inquiries. Interestingly, we had a recent surge in demand of vaccine this past month. We were doing about 50 shots during the course of the summer on any given month, but in September, again, due to the rollout of the bivalent, and I think also because individuals are more sensitive to respiratory season these days, we did 250 shots over the course of September, and 25 of those were done at a clinic at the Celebrate Mansfield event. We continue to vaccinate the homebound. Since the inception of the homebound vaccination program, in the winter of 2001, we've administered 232 shots to the homebound. 42 of those are in Mansfield Revenant. And we continue to operate that program for the foreseeable future. I'm going to move on to surveillance and reporting now. We continue to provide weekly reports to all stakeholders and partners in the community. Ryan puts those reports in your packet, and one of them is in your packet for tonight's meeting. Interestingly, one of the things we're observing in terms of the prevalence of case data that we haven't really observed since the onset of the pandemic is a lack of a real trend, either up or down in a number of cases. It's been relatively, it's been kind of static, for lack of a better way of describing it. We've been ranging anywhere from 65 to 85 cases since June on a weekly basis, and which is interesting in its own right. That being said, those cases, each individual reported case represents many more cases that are unreported, because, as we all know, there's lots of self-home administered testing out there. So I would say for every one case that's reported in that report, there are probably 4 or 5 other cases that go unreported. So that's an indication that there is a relatively high rate of transmission in the community, and it has been that way for some time. But while there has been a relatively high rate of transmission, it's important to note with the CDC's new measures on how to gauge risk in the community, for the most part, Tolland County in our area has been either at low or moderate risk in terms of COVID-19 community levels. And Just, you may or may not recall that those new measures which were rolled out at the end of last winter were based on our local healthcare capacity to handle more severe cases, hospitalized cases, and measures of that nature. And so far, under using those measures, we seem to be doing reasonably well. It's important to note, however, while we do have better tools to combat COVID-19 through vaccination, self-testing, and test and treat therapies that are out there that are effective, it's still important for those with higher levels of risk, those who are immunocompromised and others. It may be appropriate for them to take extra precautions, particularly given some of the higher transmission levels that we are experiencing in areas. So one of the things the Health District is doing is trying to get that message out as much as we can. So there's been a clear transition from some of the community-based interventions, mitigation measures that we're all used to, away from that towards more individual responsibility, more encouraging people to avail themselves of the tools that are available. And we're able to do that because not only because there are a lot more tools out there, but also there's been population immunity, which has developed over the past year or so, which is also having a positive effect. I'm going to move on to outbreak response. That's part and parcel to the shift in approach by local public health and state public health authorities. We're now very much focused on employers and schools and daycares. If they have an outbreak that gets reported to us, then we do work to provide them specific guidance and technical support on responding to that outbreak. We have, since the start of the school year, responded to 6 such outbreaks here in Mansfield. 2 of them were among daycare centers, and 1 of them was among a school. And so that continues to be an important part of the toolbox that we employ to combat this disease in our local communities. And then finally, under the updates section of my presentation, a big part of what the Health District does for all issues of public health is public health education, getting information out to the public, targeting higher risk groups with information. Certainly we're leveraging social media, our website, and when necessary, we'll put out press releases. In fact, we're also working with United Way right now and trying to recruit student ambassadors to do outreach, social media outreach to the youth in our population. The youth tends to be one of the age ranges where vaccination rates are lower than we'd like them to be, and so we're working with some of our community partners to try to address that. So that concludes my COVID-19 update. I'd be glad to answer any questions on that.
Yeah, why don't we pause here, and then we can do the new business piece. Mr. Coleman.
Yeah, I've been watching the news closely. The media is describing it as a tridemic year with 3 viruses: the RSV virus, the influenza virus, as well as the COVID-19. People can get a combination of these viruses and, of course, exacerbate one or the other viruses they get it. What is the health department? Are we prepared for this tridemic sort of thing, or is there anything that the health department can do?
Well, I think prepared. Well, I think we're certainly prepared to get information out to the community. We're prepared to leverage vaccinations, both for COVID-19 and for flu. The RSV issue is relatively new. I think we all know from media reports that many of our acute care hospitals treating the very young are at surge capacity. And so one of the things that we have started to do is push information out on RSV. I am not as familiar with RSV as I am with the other two viral illnesses. Certainly, which means that's probably an area of improvement that we could work on. But for the most part, I would say we are reasonably prepared. Of course, it all depends on what kind of surge we're looking at, and nobody really knows. I think there is an expectation that both COVID-19 cases and influenza cases will increase as we approach the summer months. And I think that that will determine and drive how much resources needs to be put into those responses.
I think we could be looking at some pretty full hospitals again, you know. I'd hate to see it. Do you have any plans if that happens? As far as, you know, providing space for patients that can't be taken into a hospital? Or is that not
Yeah,
your purview?
I would say that the health district isn't in a position to provide clinical space.
Yeah.
But, you know, we have worked with hospitals before in the past. During the peak of the pandemic, we had activated our MRC, our Medical Reserve Corps volunteers, in the event the hospital needed the extra staff to accommodate the surge of patients. So, and we could do that again if we needed to.
Okay, thank you.
Yep.
Thanks. Other COVID update question? I just have one. I know you said people aren't really sure what to expect, but you know, we're entering soon into the holidays, probably the first sort of set of holidays followed by winter months where, at least in Connecticut, there hasn't been, you know, nearly universal masking in businesses. Certainly in schools last year, masking was still a thing at this time of year. And so can you give the public the best sort of public health preview and advice that you can while you're here sort of talking about this?
Absolutely. I think it's critically important that individuals certainly stay up on their vaccines, make sure they've got their primary series completed, and then certainly get the bivalent booster. I think that's one of the most important things that an individual can do to prepare themselves. I encourage families to consider getting their children vaccinated. Children of the age 6 months and older are eligible to be vaccinated against COVID-19, so we want to encourage families to explore that possibility. We also want, it's also critically important to understand that while many cases are mild in the current strains that are circulating, nonetheless, it's important to identify yourself as a COVID case and get yourself self-tested, even with the most minor of symptoms. A slight stuffy nose, slight itch in the throat, you know, some fatigue. Even if you kind of chalk it up to allergies or whatever, I think it's still critical to get a home test. They're readily available because it's important that if you do have COVID, to identify yourself quickly and to isolate accordingly. That's also an extremely important step that an individual can take to protect not only themselves, but their family and those who are most vulnerable in their family too, because that's the one thing that our current approach has done is it's actually put many of our most vulnerable kind of to the side here slightly. Individuals who are most vulnerable have to take extra precaution. They still have to consider whether it's worth the risk of going into crowds. They still have to consider whether they should be using masks on a regular basis. And they have to be very careful to watch for symptoms and get tested and treated as quickly as possible. Most of those who are hospitalized today are those who are the most vulnerable, the elderly and those who are immunocompromised. So identifying yourself as a case and isolating yourself from those who in your family are most vulnerable is one of the most important things you can. And then if you do if you do test positive, then talk to your doctor. You may be eligible for treatment because there are a lot of effective therapies out there today. And then finally, support other individuals. If you see somebody wearing a mask or somebody who's obviously concerned about space issues, be sure to respect that. Be sure to accommodate it. Be sure to make sure that that they feel comfortable. So that would be some of my primary messages.
And I guess, I know you said no one really knows, but, last year following the holidays in early January, really sort of late December and early January, we saw, at least 30% of tests being positive and a real huge, incredibly significant surge. And so
Yes.
are we expecting, does the state expect something similar or something less?
The answer to that is we don't know. We expect something. I think everybody anticipates that there's going to be an increase in cases. Some of the current variants or subvariants that are out there circulating are amplifying at relatively high rates in other populations around the globe. But those are among populations with kind of a lower level of immunity that we have in the United States, so it's unclear as to whether or not those subvariants could have the same effect here. Often the UK is kind of a precursor to how the United States may respond to a particular variant, and they are seeing some increases now in cases, but again, it's too early to tell for sure.
Thank you.
Problem.
Anyone else on COVID? All right, then let's move on to new business, and we can go through the rest of what the health department does, which is significant. By clicking the mouse.
Page. By clicking the mouse. There we go. Okay, part 2 of the Eastern Highlands Health District presentation tonight is an annual update on our activities over the past year plus so, and also I'll be talking a little bit about some of our current initiatives and plans for this current fiscal year. I don't believe I've ever, in the past, have ever really been before this body and described in any kind of detail the scope of services that the health district provides. I think it's not uncommon for individuals not to fully understand the full scope of services that we do provide. And I'm going to hit the highlights tonight. These are the 4 primary program areas in which we oversee: communicable disease control, environmental health, community health, and public health emergency preparedness. Starting with communicable disease control, you may or may not be aware that there are about 70 diseases which state statute mandates that they be reported when diagnosed either by a physician's office or by a laboratory, that those reports get provided to the local public health director and the state health department. And of course, you can imagine that list includes diseases like COVID-19 and influenza and others. In fact, this past fiscal year, we received 717 case reports reviewing. We get about 700 to 1,000 every year. Our response to those case reports varies and is dependent on the actual disease itself. Many of them are just a data point and added to a database. No direct follow-up is necessary, where others is just kind of a moderate or low-level response. Others, the state health department is responsible for responding to, not the local health. Others, it's a combination, kind of a team approach. And then finally, there are those which essentially the local health department is responsible for responding to. Two of the most topical ones that have come into the limelight recently are monkeypox and Ebola. Most recently, Ebola. Monkeypox, you may recall, started as we started seeing cases in the United States a few months ago. In the state of Connecticut, right now, there are 138 cases since the onset of this international outbreak. There's actually one case located here within the Eastern Highlands Health District. And there's also a second case, while not a resident of the health district, did unfortunately expose a number of people in the workplace setting. So we're involved in that case investigation. One of the local health department role in responding to such cases involves the initial contact with a case, conducting an interview, assessing risks, and identifying close contacts, many of the same things we did with COVID-19, and then connecting with the close contacts, and then monitoring close contacts for symptoms on a daily basis for 21 days, because the incubation period for monkeypox is 2 to 21 days. Luckily, we haven't had more than those 2 incidences to date, and it appears that, in fact, the cases, if you look at the epi curve, seem to be waning here in the United States currently, and Connecticut's no exception. Also, most recently, Uganda and their Ebola outbreak. You may recall in 2014, there was a similar outbreak, except there was actually a number of travelers at that time that had come to the United States. A health district, local health department's role in that is identifying those travelers, actually not identifying, but we're notified of the travelers, and then we have to connect with the travelers, conduct an assessment, and then monitor their health for a subsequent 21 days. Interestingly, the incubation period for these are pretty much the same. Right now, we have no cases or no travelers, from Uganda within our jurisdiction, and I don't have the information with me. I can tell you that that the CC considers that particular risk pretty low in terms of travelers to this area. But, you know, knowing Eastern Highlands Health District, we do service an international community here in the Mansfield area, so it's plausible. So more to come on that one. Flu. We're in the 3rd year of our new flu vaccination program. Before, just as the pandemic started, is when the Eastern Highlands Health District hired its first nurse and started doing flu shots, and we've been doing them ever since. We've been not administering a lot of influenza shots. We're looking to expand that in the future. We did administer 75 shots at the Celebrate Mansfield event in conjunction with those 25 COVID shots, and we continue to for this year we've hosted about 5 flu clinics thus far, and we're hoping to expand that into the future. And so that's a big part of our infection control efforts regards to influenza. So moving on to the environmental health program, which is really the largest program area of the health district. It's the meat and potatoes, for lack of a better term. It commands 70% of the resources of the health district. Selected I do have some selected numbers for you, selected number for you for specific service areas. In fiscal year 22, we conducted 260 food service establishments inspections in the town of Mansfield. We issued 57 permits to construct septic systems. We issued 30 permits to drill private drinking water wells. Reviewed 111 building projects. Grabbed 19 samples for bathing water quality, most of them at Bicentennial Pond. Investigated 16 complaints, many of them housing complaints. We do work very closely with the housing department here in the town of Mansfield. There are some complaints which it's just more appropriate for us to take the lead on. if it's a water quality issue outside the scope of testing that they require, or if it's a mold issue, or some other kind of ancillary issues, then we often take the lead, but do work very closely with Mike Ninto and his team on these matters. Current environmental health initiatives include a recent adoption of Section 5 of the Eastern Highlands Health District Sanitary Code, which creates the requirement for hairdressers, barbers, and nail salons to receive annual operating permits from us that establishes inspection standards for us to conduct annual inspections. You have about 14 businesses in the town of Mansfield that are affected by that new, what is effectively a local ordinance, and there are about 50 health district-wide. We established this ordinance more or less to come in compliance with a state statute. It already mandates that local health departments do annual sanitary inspections of such businesses. But the statute doesn't have any inspection standards, doesn't have any permitting standards, and so we created those so that we could facilitate compliance with that statute through the adoption of this sanitary code. Yes?
You may have just mentioned, does that include tattoo and piercing establishments?
No, there are separate regulations for that. Separate regulations that already exist. Yep. We inspect those on a complaint basis. There's no standard annual inspection of those. While there are some local health departments that do, because they have, again, passed ordinance to that effect. There are standards for the inspection, and so when we do receive a complaint, we do follow through accordingly and apply those standards. Another area where the health district is seeking to improve customer service and streamline operations and improve productivity through an online permitting system. We rolled that out in April 2020, but most notably over the past year, we've materially expanded it to include the annual renewal of food service establishment licensing, and of course, and we've incorporated our new cosmetology program into that. Moving on to community health. One thing that many are not necessarily aware of is that we get funding every year from a Preventive Health Block Services grant, and we leverage that funding through, and our mission under that funding is to identify and help develop sustainable policy, systems, and environmental changes which promote healthy behaviors like active living and healthy eating. We actually have a committee that helps us with that. It's called the CHART, the Community Health Action Response Team. That chart has actually been in existence for over a decade. Every time we get grant money with that mission involved, they help us with a work plan and implementation. Most recently, where members are active, where the health district has active membership on the Bike Mansfield group, which just spoke to you tonight. We help them and support the development of many of the initiatives and programs that they're engaged in, which also includes participation in the Yukon bicycle work group. And so we'll continue to participate in that moving forward as part of our block grant funded activities. Also, we developed a toolkit. It's called the Health and Communities Toolkit. It's actually a web-based toolkit targeting planning and zoning commissions and planning and zoning commission members, encouraging them to implement when they're considering decisions on land use, to consider the public health implications, such as are there going to be opportunities for physical activity in these particular land use decisions? is, does it promote farmers markets and agriculture? And so that toolkit is actually in place. It's linked to our website. And it's been there for a number of years, and most recently, we do workshops for Planning and Zoning Committee members if they're looking to learn more about that particular toolkit. And there are a number of other policy and systems and environmental changes that the health district's been involved in over the years. One other thing I just want to mention you're probably not aware is we did many years ago get a Safe Routes to School grant, and it was that grant working with Lon Holgren and other partners here in town of Mansfield about a decade plus ago that developed the initial concept of putting that sidewalk from Route 89 up to the school. It was part of the so the health district's efforts to get that grant and to promote that issue was kind of one of many seeds which were planted to kind of get that particular project moving. Finally, health education, again, there's a lot going on here, much the same activities that I cited with regards to COVID-19. We also leverage for other public health issues. RSV is certainly one. And so anytime a topical issue comes up, we're leveraging all our communication platforms to try to get information. Public health emergency preparedness and planning. We do employ a part-time public health emergency preparedness coordinator. The individual is responsible for updating all our emergency response plans. We have a whole slew of plans. We probably have as many as Adam Libros does, emergency management director. Volumes developed over many years. We get funding annually through the CDC, pass through the state health department to employ that person, keep those plans up to date, provide training to existing staff, and we conduct exercises on a regular basis to test all of those plans. And then finally, I want to, and I mentioned this earlier, I want to note the critical asset that is the Medical Reserve Corps. The health district has a roster of about 200 volunteers. They're a core of about 40 or 50 that have been with us since the start of the pandemic, providing services like contact tracing, supporting pop-up testing services, and of course they're filling important staffing gaps when it comes to both our COVID-19 vaccination program and our influenza vaccination program. And they continue to be a foundation of our efforts here to respond to public health emergencies at the Eastern Highlands Health District. And we couldn't have done what we did here at Eastern Highlands without their support. Many of the clinicians are local. You know many of them. I won't name names, but I'm sure that there's people on this roster that you all know. See. And I'll wrap up here with a number of initiatives that the health districts engaged in now are going to be looking to engage in the current fiscal year. Their new childhood-led regulations, which go into effect. They're going to be phased in over the series of 3 years. First phase, I believe, starts January 1st. These new regulations effectively lower the blood lead level in children to align with the CDC recommendations. For many years, for whatever reason, the state of Connecticut was not aligned with the CDC recommendations. The impact of those regulations is going to allow local public health to get into some of these homes earlier, to conduct epidemiological investigations and environmental investigations to ascertain the source of childhood blood lead, and to get case management of these cases sooner rather than later, and then subsequently compel abatement in some of these homes that have environmental lead in those cases where it's necessary. And while we are anticipating additional funding to support this program from the states, nonetheless, it's going to increase our workload by 5 to 10-fold when this regulation is newly implemented and we're in the throes of it. So we're looking forward to seeing how the State Health Department recommends these additional funds be rolled out so that we can do the best job we can to protect the children in our community. We're going to be expanding online services to the OpenGov platform I referenced earlier. We're looking to expand it into quarterly reporting and into, we're going to apply it in the field with tablet utilization. And we're also seeking to use it to track complaints and other enforcement activities. Itinerant food vendor MOU. The State Health Department through Public Act worked with the Connecticut Association of Directors of Health to create an MOU which any local health department can sign on to. Effectively, what it does is it creates reciprocity for itinerant food vendors that we license annually here within our jurisdiction, then can therefore go into the jurisdiction of any other local health department that signs on to this MOU in the state of Connecticut. This was an effort by the governor's office to support small businesses. We do have 9 itinerant vendors within the health district, and I know there are at least a couple here in Mansfield which will benefit from participation in the MOU. My board has authorized me to execute this MOU later this winter. One kind of uncertain thing, while it does authorize operations, food service operations in any participating local public health jurisdiction or itinerant food vending, it's still unclear whether it will apply to temporary food events like the Celebrate Mansfield. We're still working on that piece, so more to come on that. And then finally, another initiative is regarding opioid misuse in our communities. The health district was deeply involved on this issue before the pandemic. About 4 years ago, we had procured some grant funds, improved communications, engaged in a campaign to improve awareness and discourage the stigma associated with opioid misuse. And we're re-engaging now that the pandemic has waned. We partnered with the North Central District Department of Health. They recently procured a $300,000 grant from the National Association of City and County Health Officials. We're going to be using some of those funds to expand staffing so that we can engage our local communities and improve communications. Again, improving awareness and working to reduce the stigma associated with this particular issue. Just by way of background, Mansfield has had 18 deaths since 2015. So even small communities are not immune to this particular issue. And so the health district will be working. There's also, you may have heard that there was a national opioid settlement funds that are now available to all the communities. At the last board meeting, the board tasked me with working with some of our partners to come up with guidelines or other ideas on how this money could best be spent to address this issue in our local community. So that concludes the Eastern Highlands Health District annual update. I'd be glad to answer any questions, and I just want to, before we end, thank you once again for this opportunity to kind of give you an update and what is really a snapshot of the many things we're doing at the Eastern Highlands Health District.
Thank you very much. Questions from the council? Cotton?
Thank you so much. This briefing was pivotal. I just wanted a point of clarity. You mentioned the itinerant food vendors memorandum of understanding. Here I'm looking at iterate.
Oh, misspelled.
Okay, I just want to
Sorry.
make sure,
Thank you
because
so much.
that's a legitimate word too. So I
Yeah,
just wanted
no.
to make sure.
Itinerant, my
As
apologies.
in traveling, right?
Itinerant, that's exactly right. These are mobile itinerant food vendors, food trucks,
Right,
self-contained units.
got
So,
you.
sorry about the
So that's
typo.
one thing. And then with the opiate misuse, I don't know if yours was the same program. I believe it was, 4 years ago that you all had a grant and were giving training around town. I happen to have taken
Right.
that training. It
Narcan
really
training?
was. Yes,
Yes.
Narcan training. It was really eye-opening. To this day, I still carry and go to the pharmacist and make sure I keep updated Narcan with me. I'm hoping that what you're saying is you're going to bring that level of training even to local citizens back as well.
That's correct. Yeah, we're going to be working with Hartford Harm Reduction Group. I don't know if you've heard of them, but they're a well-established group working on all things in terms of reducing harms associated with opioid misuse. And so they're one of the partners in the grant that was just recently awarded to the North Central District Health Department. So we'll be leveraging that partnership for that purpose. Which reminds me, there's also a toolkit, since we're on the topic, that's on our website. I know at one point in time, this body was considering staging Narcan in the town hall and other public buildings. I know that Youth Services staff here at Mansfield, we partnered with them to develop those templates, the policies, the standing order, storage requirements. I know there was, and we underscored the Good Samaritan laws that we thought permitted that, but I guess there were some legal concerns associated with that issue. So it might be worth, that was a number of years ago, so it might be worth re-exploring.
That's a great idea. Yeah, that predates me, so go.
All the information's right on our website, all the template materials.
Okay, thanks. Other questions, Ms. Berthelot?
Yes, thank you. Boy, you're busy. I have a question about the mold inspections.
Sure.
I may not be understanding it correctly, but if somebody's living in a home and they're renting the home and they suspect a mold problem and they've gone to the property owner and they don't feel like the question's been answered, would they reach out to you or do they reach out to the town?
They could reach out either to Mike's group or to our group. Both contacts will get them where they need to be. Usually when there's mold, there's moisture, and where there's moisture, there's maybe a plumbing issue or ventilation issue, which could be Mike's purview, but the mold itself is our purview. So often we'll take the lead at the health district on investigating mold issues, and sometimes we'll involve Mike if it looks like it's going to be plumbing or ventilation. So the short answer is they should just call our main office and just talk to one of our sanitarians and let them know that what they're seeing and that they're concerned, and we will follow up.
I have the privilege to work with young people, and they don't often know how to exercise their legal rights. Is there on your webpage, is there anything about, like, if you have these concerns, this is the right place, or would they go to 211 and get to you, or?
Yeah, so we do have information about mold and housing on our website. We do have a form if somebody wants to request services or make a complaint. It's right on our website. And so they can go under, I think it's under the environmental health tab. And I believe it's a request for services / complaint. And so they can go right on the website and fill out their information. They can make an anonymous complaint, and we would still follow up on it. But to your point, I think what you're implying is correct. You know, I think not everybody really understands that the health department is a service that does provide these types of services and that they can call us. So that's it's a reasonable
I have to be honest, I
thought.
don't think I would have immediately thought the health department. I would have thought the town, but not the health department. So this
Well,
was really
so,
helpful for me.
you know, in the state, that's a state of Connecticut artifact, right? Because many municipalities have their own full-time health department. They're not part of a health district. But yes, housing complaints can come to the health department. We will follow up on everyone, and if it's appropriate to refer to Mike, then we'll do that, you know, quickly.
Great, thank you so much.
You're welcome.
Other questions? Mr. Sherrin?
Yeah, just a quick side question. Your jurisdiction does not include the Yukon campus or the facilities thereon.
It's a blend. For the most part, you're correct.
Okay. So
For the most
just
part, you're correct.
out of curiosity as a consumer, who is responsible for inspecting food establishments on the campus and other facilities?
Right. So that is, there's actually an environmental and occupational health section on campus. They have a director. They employ inspectors, certified food inspectors, and so they do conduct inspections for compliance with the Connecticut Public Health Code.
Mr. Coleman?
Thanks, Rob.
Yeah.
Getting onto the new childhood lead regulations, did you have any figures on blood level? You know, what's the difference between the old ruling and the new ruling?
Yes. I don't have them all off the top of my head. I'm sorry I don't have them in front of me, but the main ones right now, 5 deciliters, 5 deciliters per milliliter of blood lead triggers an education intervention by the health department as it currently stands. So we send materials to the parents. We get those lab reports come to us from the lab or from the doctor's office, and then we send out very specific educational information to the parents, and we'll follow up with a telephone call to see if they have any questions. So it's an educational intervention only. To trigger an epidemiological investigation and environmental health investigation in the dwelling, we would need blood lead levels at 15 micrograms per deciliter. I'm sorry, that's the correct unit. From a venous blood draw, 2 venous blood draws 3 months apart. And that would trigger a more aggressive, going into the home, we're going to do an investigation, we're going to figure out how this child's getting poisoned. And then we're going to identify those sources and then order abatement of those sources in that dwelling. What the new regulation does is it brings the trigger point of education down to 3.5 milligrams per deciliter. And the intervention, the home intervention, I think ultimately down to 5. So it goes from 15 to 5. That's a big shift. And so there's going to be a lot more interventions in the home, which will involve interviewing parents, grabbing environmental samples, and compelling abatement of those leaded conditions in dwellings. And that's both for rental and owner-occupied dwellings.
Okay, thank you for that. Now, it's not going to change anything with actionable levels of lead in the water?
Well, part of the investigation will include sampling the water.
Okay,
certainly.
so there's real no correlation of actionable levels in the water and the amount of lead that would be in someone's blood?
I'm sure there probably are. I don't know what they are, but, our job are under this, under these regulations will be to identify all sources of lead and have them and compel them to be removed.
And we have had actionable levels of lead in some of our schools, most notably the new elementary school. And I remain concerned about that, and I remain concerned about the exposure to our children who may have been exposed to lead during that period of time. Are you following up on that situation? Is the health department following the situation down the old Southeast School? Regards to DEP, CEQ, or DPH?
We have remained in contact with Mandy Smith and the water supply section at the State Health Department. We certainly are aware that your certified treatment operator, Connecticut Water, has hired extra support to address this issue. So yes, from that perspective, we continue to stay engaged on that matter, and we will remain engaged until we're assured that the water for the new school is in compliance with the clean drinking water regulations.
Okay, and what would be the next step in your departments and on making sure that happens? When are we going to test it?
Well, we're staying in, like I said, we're staying in, let me just tell you that, as you know, the State Department of Public Health is a primary authority and an enforcer of the regulations associated with clean drinking water regs. Our department provides support when needed, and we often lean to the State Health Department on matters like this. That being said, as an added just set of eyes and an added head in the issue, we are staying in close contact with Mandy Smith and the State Health Department on this issue.
Okay, thank you.
You're welcome.
Other questions? Not. Thank you for spending some time with us this evening, Rob, and for coming again. Hopefully we won't have any more severe public health outbreaks in the near future that would
Let's hope.
necessitate seeing you every 2 weeks. And thanks for the update on everything that your department is doing.
You're welcome.
Mr. Bruder.
Deputy Mayor, I would like to move to amend the agenda to move item F, the land sale option, up to item B, so that everything will shift down, and we can have that presentation as somebody's in the audience right now.
Is there a second? Second by Ms. Berthelot. Is there any discussion? No, let's vote. All in favor, raise your hand. Is Al voting? Oh. He's not there. Okay. The agenda has been modified, and so we will now move to what is in your packets as new business, item F, which is the land sale option, the purchase of 105 acres at UConn's Depot campus. And I will ask Ryan to introduce item and introduce our guest.
Thank you, Mr. Shaken. So tonight we have Robert Corbett from UConn. Robert's official title, you're the Executive Director of Real Estate, what's the?
So it's, yes, Executive Director of University Planning, Design, and Construction. And I also handle all of the real estate transactions for the university.
So the only thing I'll say before turning it over to Robert to walk us through this, the council, I know has been following for some time and with some interest, some discussion about an autonomous vehicle track that would be constructed on the old Depot campus, and the potential for that project not only to help pave the way for all sorts of new and exciting R&D type things and well-paying local jobs, but also transfer a large chunk of property potentially into private ownership and, of course, generate property tax revenue. So generate a lot of community benefits for the town of Mansfield. But before turning it over to Rob, Robert, I just want to say that, this project will go through all the normal local land use regulatory review kind of steps and protocols along the way. And so notwithstanding the interest that the council certainly has in this concept, there's still a whole process that would ensue if the sale takes place and if the project progresses kind of as envisioned. So with that, Robert,
Can I just jump in real quick? If you may be going through this in some detail, but just so that the council is aware, very happy that Robert's here to give us an overview of the project. I am very curious to hear about it, very excited to hear about it. The question before us tonight is not how do we like the project or whether we think UConn should move forward pursuing the project with their private partner, but that UConn has extended a offer. I think it's probably not technically this, but I think of it as an offer for first refusal on the sale of this land. If we wish to purchase it, we need to do so. And there's some legalese as to whether they're required to. They say they're not, and they're saying, but they're doing it anyway. So the only question before us tonight is, do we want to say, actually, we want to buy this property from UConn or not? And if we don't, which is what the staff have recommended for us on page 240 of our packets, then UConn may move forward with this sale to a private developer, and they'll have to go through all the different land use things. So with that, just so everyone's clear about what we're being asked to do tonight, please take it away.
Great, thank you very much. Again, I'm Robert Corbett, represent the university. I've worked for the university for the last 10 years in this capacity, and as the chairman said, this is about an option to purchase land. And so the town's action is they have a option, a right of first refusal on that option. And I'm going to talk a little about the real estate transaction, and then what is proposed as the facility, and then a little bit about the operating agreement and the advantages for both the university and the town. All right, great, thank you again. So the real estate transaction is very straightforward. We propose to sell between 100 and 105 acres to a private developer. The developer is a developer as well as a financier. They don't have any specific experience in operating tracks, but that portion of the project will be taken by the university. The reason it's a little fluid is that the land area as proposed today includes some buildings that are in a dilapidated condition, but they are part of the historic district. And so to the extent that SHPO allows us to transfer those buildings and become part of the development, that portion may or may not be included. As I'll talk about in a minute, there are some value to those buildings to this developer. They basically create like a cityscape where they can utilize the outsides of the building in kind of a Disney-esque fashion. So they become impediments to vehicles that are crossing traffic and things like that. So again, that portion is up for debate. The approximate price then for the transaction is $5 million. That could increase or decrease by $50,000 an acre, depending on what the final acreage is. It is a purchase option, which means we don't convey the property until we reach the end of the approval process. The initial term is 9 months, but there are 4 options to continually extend the land option agreement, assuming that the developer is making, headway on their approvals. And as Ryan mentioned, this does have to go through all of the town's approvals. zoning and wetlands, and so there are a number of steps that would have to happen on the town side in order to convey the property. When we do convey the property, and as is in the agreement, there are covenants that restrict the land use basically for, a vehicle track as well as energy research. And so one of the outset questions probably is, from the town's perspective, why would we sell this as opposed to just developing a track ourselves? There's really two reasons. The first is that the developers bring opportunity zone money. And so, the ownership is more important to them than to us, and it becomes complicated if we remain in the ownership structure. Second reason is we think that this gives the developer a lot more flexibility going forward. When the university is involved in ownership, there are a lot of statutory requirements. So this gives the opportunity for the developer to really work with the town and develop a product that both the town, the university, and the developer will be pleased with. This is an example of what one of these facilities looks like. This one's in Pennsylvania. There are only 5 other smart city facilities. When I talk about a smart city, what we're talking about is basically, technology development that improves energy efficiency, automation, minimize gas emissions, promote sustainability, and improve the quality of life. That's the 5 kind of pediments of smart cities. And that's really where the university wants to be in the future in terms of developing its research and development. And this one specifically, obviously involves vehicles. And so the vehicles are electric vehicles and they're hydrogen vehicles. And so, one of the other concerns in town might immediately be, that this is a track with automobiles on it, but these aren't, combustion engine tracks. These are much more quiet. And really the intent is to be very quiet and not impact, any of the local residences that are in the area. So a facility like this basically needs certain components, and this really drives the desire for the amount of land that they need. They need a rural section where they can, have these automated vehicles go around curves in both daylight and in shadows. They need a long straight section so that they can get the vehicles up to certain speeds to test. They need a cityscape with a lot of signalized intersections. And this facility is proposed to really start with 2 different buildings. One where they'll run the automated track out of, and then the second will be a research and development and innovation hub where they will bring third-party partners to the site. The hope is to create a consortium of about 10 to 12 different companies, private companies who are in the auto industry, who would come and test all their vehicles. And so it's about startups and innovation and research is really, at the end of the day. The initial minimum investment by the developer is $40 million, which includes the purchase of the land. So this is the complex operating side. I won't go into too much detail on it other than to say that CTI is really the core of the operation. They've been at the university 20 years, Connecticut Transportation Institute. They're one of the pioneers and leaders in automobile research. And so even though there's a development company and this consortium, it really will be mostly up to the university to maintain and operate the facility once it's constructed. Talked a little about smart cities. Really, this is the future. This is about the innovation and the vision. Spectrum Park is a developer who is financing the majority of the costs for this development. So if we jump to the benefits, for This is one of 5 facilities that exist in the country. It's the only one in the Northeast. So it's an opportunity to expand partnerships beyond Connecticut and bring in out-of-state business into Mansfield and into Connecticut. Obviously, for us, it's about research and educational opportunities for both undergrads and graduates. We hope to start with those 10 to 12 startup companies and create incubator space right on the site. And for the town, it's about increased employment and property taxes. At the outset, we expect the employment to be in the range of 30 to 50 full-time individuals. And then with the hope that, as the innovation and the incubators, pick up, that would increase and additional buildings would eventually be built on the site. So I'm happy to answer any questions you might have about the facility or the transaction or the operation.
Questions from counselors? Well, I'll just start. Oh, Mr. Coleman, go ahead.
I just have a comment. I think it is a very nice gesture of the university to offer the town of Mansfield first refusal on this property. I mean, that's a very positive step. Thank you.
Sure, I didn't mention that. So just to give you context, Depot Campus is about 250 acres. So it's a substantial part of the campus. Also, really only the roadways get built. It is a pretty forested area right now. So the roadways get built through the forested area, but we try to keep as much of the forested area as possible.
So I have a question about that, maybe if you want to go back to the map in your
Sure.
presentation, if other counselors don't. So it seems to me like, looking at this aerial photo, that this basically roughly mostly encompasses the undeveloped portion of the Depot property, which is the former institution, Mansfield Training School, and much of which is in significant amount of disrepair, blight, whatever you want to call it, and also much of which is a National Historic facility. And so can you explain those two little bits in the sort of top part where there are structures? If you're familiar with the old training school property, what are we looking at that this would encompass? And what does it leave out?
Yeah, so it is all undeveloped area with the exception of 10 buildings, and those are the 10 buildings that were historic, that are dilapidated. We use a couple of the buildings for storage that are historic, but this would transfer the majority of the remaining buildings that are historic but are in poor condition. So they represent kind of that very center piece of the drawing. And again, that portion being transferred is very much up to SHPO because they would have to allow the transfer from the state and then also allow the use as basically just the exteriors without any adaptive reuse of the interiors. So that's probably one of the bigger question marks. The rest of the land that's conveyed is all undeveloped and unused by the university presently.
And so if I'm looking at this, I can identify where the old community school for the arts is, where our current, which is roughly around where your surplus facility is, where our
Correct.
current maintenance facility and storage facility is, that the town uses in that parcel, and then closer to Route 44 is the area where where the Transportation Institute is currently located, where all the engineering concrete research is happening, and across the street is the old prison, which you're also currently using. So let me just make sure I'm clear. What you're saying is the buildings that you're proposing to sell are the total amount of the old training school, that's the historic property that is currently in disrepair, the haunted place, whatever that everyone in town knows is there, that you're not actively, people don't work in every day, et cetera.
Yeah, that's correct. We're selling the majority of those buildings. Again, a couple of them we currently use, but anything we use, we are not transferring. So it's only the ones that we do not currently use that are in that dilapidated state.
And would you anticipate in this development that the structures might remain in some form or another with some changes to the streetscape and whatever else might need to happen, but that there's not an idea to demolish them and build something else?
No, that is the proposal that's under consideration right now, which is to keep and preserve the exteriors of those buildings, just not put the interiors back in an adaptive reuse.
Okay, thanks. Well, or sorry, Mr.
Yeah,
Ellsworth.
so I just wanted to confirm, because I'm sure this polygon, while it's relatively precise, it's not like incredibly precise. And so actually I want to pick up on something Mr. Shakin said, which is, so when I and staff looked at this, it appeared that to the extent that the boundary goes through, and it's hard to describe exactly where I'm looking, but basically where the tree line and buildings come together at kind of like a 90-degree angle, it looks like the boundary kind of goes through, kind of bisects a building, but that building is to the kind of south and east, I guess, of the facility that the town leases right now for our facilities maintenance shop. So as far as we're concerned and for our own immediate planning purposes, this would not directly impact that facility. Is that accurate?
That is correct.
Bruder?
I was going to make the motion if no one else had any more questions. But
Are there other questions, Mr. Coleman?
Yeah. I got a couple. How long has the university owned that particular parcel of land, and are there any known environmental contaminants on that land?
So we've owned the property since about, the mid-1990s. The property has not been in use. It was not in use from about 1972 up until our ownership in the mid-90s. So it was about 20 years where the entire campus was not occupied. We occupy selective, buildings on the site today. The environmental conditions are a little unknown. We do anticipate uncovering some environmental conditions when we look at those SHPO buildings particularly. The way the agreement is today is that we will address the environmental conditions when they're identified.
Okay. If the town were to purchase that property, it would be the town's responsibility to do any environmental testing, or?
That is correct, yes.
Okay.
Well, before Sam, you may, or maybe if there are any other questions, Sam, why don't you?
okay, I move to authorize the town manager to convey to UConn that the town does not wish to purchase approximately 105 acres of land at UConn's Depot campus as proposed in the terms between UConn and Promesa Capital LLC.
Berthelot seconds. Is there a discussion?
Just to piggyback on what everybody else has already said, I think this is a great opportunity for the town to be in private hands, and also very much appreciate that you've come here tonight to show us and just give us an idea, understanding that it could not go forward, but just very much thank you.
My pleasure.
Other comments? I'll just echo Mr. Bruder's comments then and say that I'm excited for this. I hope it moves forward. I think it's exciting from a, this is, if I had to rank the places in town that I wish didn't look the way that they look, this would be number 1, 2, and 3, both just from a blight perspective, but also from a history of what the training school was when it was open perspective, and wanting it to be something other than a place that people think of as sort of haunted memories of that time. Personally, I think having the space in use for something new and innovative that doesn't look like a dilapidated old training school would be really, really awesome. In addition to our tax revenue and jobs and everything else that will come with this, which is great. And finally, just to echo my thanks to you for being here. And it's been a while since someone from the university has come to talk about your sort of master planning in one way or another. At least 4 or 5 years. I think Laura Cruikshank and some others were here when I first joined the council in my first or second term. And so it's really appreciated to this level of partnership, and I hope it continues. and that things like this, in terms of the university's relationship with the town, continue as well as it relates to your development plans. So thank you for being here.
Well, thank you for your time tonight.
Is there other comments or debate from counselors? If not, then let's vote. All in favor, raise your hands. Any opposed? And it is unanimous. We do not want to buy this piece of property. Thanks.
Thank you.
Thanks for the offer.
The next item on our agenda, moving on, is an item from the Committee on Committees, a proposed Committee on Committees charge. And I will ask Mr. Bruder, the committee's chair, to introduce it to us and make the motion.
Yes, thank you. The Committee on Committees, as you can see in the packet, voted unanimously on October 13th to formally recommend this adoption of a revised proposed Committee on Committees charge. You can possibly remember we had some discussion on this with the town attorney in trying to, in our efforts to encourage more participation and happy volunteers, trying to see if there was a way that the Committee on Committees could make those appointments rather than just a recommendation to the full body. As we found out, that is, not allowed per the charter, but we still felt that the Committee on Committees charge had some really good information pieces, especially for anyone, looking from the outside in. I know that when I discuss with friends and family that I'm on the Committee on Committees, the first thing they do is laugh because they don't actually think that it's real. But this gives a written piece for people to reference and kind of get a better sense of what our role is in this process, so that we can hopefully alleviate any anyone who doesn't have an idea. With that said, does anybody have any questions or through you?
Mr. Shurin?
Yeah, well, at the time the resolution was proposed, I wanted to propose an amendment. I don't know if now's the appropriate time to talk about that.
Then let's wait till it's proposed.
Okay, so
Go for it.
I move to adopt the following resolution. Resolved to adopt the following Committee on Committees charge for the purpose of the primary role of the committee is to ensure meaningful engagement in the democratic process for Mansfield residents through committee participation. Charge, the committee interviews applicants for appointment to town committees and makes recommendations to the town council for those appointments. The committee also reviews committee charges and makes recommendations to the town council for charge updates. The composition membership, the committee is a standing committee of the Mansfield Town Council comprised of 3 town council members designated by the mayor. The mayor also appoints the committee's chair. Process, generally speaking, prior to making an appointment, the committee interviews applicants who have been vetted and endorsed by the applicant's committee of interest. Based on the interview and the recommendation of the relevant committee, the committee determines whether applicants meet the qualifications for membership as defined in the relevant committee's charge and consistent with the town's code of ethics. If the applicant meets the required qualifications and no potential conflict with the town's code of ethics has been identified, the committee makes a recommendation for appointment to a defined term. Meetings, the committee will meet monthly.
And this came through the committee, right?
Right, so no second
No
is
second
necessary.
is required. Do you wish to speak further in favor?
Not more than what I've already said.
Okay. Mr. Shurin?
I applaud the committee for putting this charge together. I think it's basically fine. I have one concern. I do understand that it's very valuable to have people who wish to serve on a committee get to know the committee's work even prior to their service, and that's a very good process. And I wish, however, to express a little bit of concern about the vetting and endorsement that could lead to a kind of groupthink. So I wish to amend this on the second line under process to have it read, generally speaking, prior to making an appointment, the committee reviews applicants who have been reviewed by the applicant's committee of interest. And the rest is it.
All right, is there a second to, seconded by Mr. Coleman? Did anyone like to speak on the amendment further? Mr. Bruder?
I accept that as a friendly amendment.
I will rule that that is technical enough to be a friendly amendment. So the motion has been amended and changed as Mr. Shuren outlined. Is there any further discussion on the charge as proposed, as amended? If not, let's vote. All in favor say aye, or raise your hand, sorry. All right, it passes unanimously. The Committee on Committees has a charge. The next item on our agenda then is, let's see, I'm now out of place here, is two items about the sewers. And so what we need to do now is, first is move to recess the council and reconvene as the WPCA. Mr. Bruder,
I move that the council recess as the town council and convene as the Mansfield Water Pollution Control Authority.
is there a second? Seconded by Ms. Berthelot. All in favor, raise your hand. All right, the council is recessed and we are now the Mansfield Water Pollution Control Authority. Mr. Aylesworth, the CSSA standard at Four Corners.
Yeah, so we can probably talk about the next two items kind of together because they're related in terms of what the council is being asked to do. And Mr. Delai, the town's assistant engineer / acting director of public works, is here to elaborate. But we have two different proposed sewer systems or septic systems that will be privately owned and operated. But these are community sewer service systems, and as a result, the town is required to establish what amounts to an escrow fund to ensure that there is adequate funding set aside for their operations and maintenance in perpetuity. And so, without any further ado, I'll turn it over to Mr. Delai to further explain what we're asking.
Certainly. So, Connecticut General Statute does allow for systems. And these agreements basically help protect the town as the WPCA to ensure that should anything occur to any of these associations or developers, that there's always sufficient funds to operate that system on the private property. So the first one is the standard at Four Corners. Back in December of 2021, there was an easement that was recommended, and one of the components of release of that easement was a sanitary sewer permit and the community sewer service agreement, which is before you now. And essentially, that's what we're asking the council or the WPCA to act on at this point in time, is to set up that escrow fund, set up that, and the operation and maintenance fund for the standard at Four Corners. And an attachment to that is the sewer permit agreement. So as you recall, there was a section of sanitary sewer that is located on private property here that is owned and operated by the town. And in order to construct their project, they need to relocate it. So there is some language in here which was slightly different from Friday's packet that I want to bring your attention to. We changed promptly to immediately, which is more in line with the Connecticut General Statutes.
Second page in pink.
Yep.
So while everyone is looking at it,
This
Derek,
would be
if you-
page 186, your packet.
Yes. Can you just tell us, for those of us who don't understand sewers as well as you do, this project is at Four Corners. This is one of the big current development there. This is an agreement for them to run their own private sewer system on their property, but that sewer system will hook in to the sewers that the town owns at the Four Corners.
That is-
Unlike the second one we're considering, correct?
Yes, you're absolutely correct, Counselor.
Is there, woman?
So the property owner will be fully responsible for the pipes under the surface, as opposed to the easement that we had in the past. if we have an easement, that would require us to maintain the pipe, is that correct?
Yes, we do own as they currently stand today, we own those pipes, but they are placing a building on top of those pipes, which
Yeah.
we said, absolutely not. You'll have to relocate them if you want to still propose that. They're relocating the pipes that the town owns, which are located in that easement, to the state right-of-way. And that would be at their cost, and that's what is spelled out in this agreement. But also the pipes that this developer will be installing for their project on private property, they will own and operate and install them themselves. However, they are paying into a sinking fund. So should something goes wrong with the developer or something, that those residents will continue to have sanitary sewer access. And there will be funds set aside should the town have to do any action. And
Okay,
that's the purpose
so
of this agreement.
You're responsible for everything up to the curb.
Correct.
Okay, thank you.
And just correct me if I'm wrong, Derek, but is it the balance that they're supposed to carry in the fund, is it equivalent to 1 year's projected annual operating costs? Is that what I remember?
Yep, you're absolutely right.
Okay.
They'll do 1 year of operation and maintenance, which is set in an escrow fund. So if something were to occur, it would provide the town an opportunity to re-budget for that additional maintenance and operation.
Well, there are motions on page 170, if I don't have any further questions. Mr. Bruder?
Move effective October 24th, 2022, to authorize Ryan J. Aylesworth, Town Manager, to execute the attached sewer permit and agreement between the Water Pollution Control Authority of the Town of Mansfield and the Standard at Four Corners LLC.
For a second? Second by Ms. Berthelot. Is there any discussion? All right, if not, we can vote. All in favor, raise your hand. All right, and then there is another motion on page 170, just above the one that Mr. Bruder made. I'd like to make that one.
Oh.
Ms. Berthelot?
I think your mic's off.
Sorry.
Move effective October 24th, 2022, to authorize Ryan J. Ellsworth, the town manager, to execute the attached community sewer system operation and maintenance agreement between the Water Pollution Control Authority of the town of Mansfield and the Standard at Four Corners LLC.
Seconded by Mr. Coleman. You good, Sarian? Okay. Is there any discussion on this motion? Not. All in favor, raise your hand. Motion passes. All right, moving on to 8C, 8D, the agreement between the town and the White Oak condominiums.
So this one is a little different in that the town has allowed for an easement on town open space on the White Oak condominium, which the council, I think last month or 2 months ago, did allow Ryan, the town manager, to execute. And this is another agreement that basically puts monies away, so we're not in the position again. And basically, they'll be able to fund that new septic system should they ever need it in the future. So this is quite similar, but it is different from the standpoint that it does not connect to a town system at this point.
Just one quick question before the motion. We know that their septic system has been in need of replacement for some time. So this agreement now mandates that they establishes this fund and mandates that they keep enough money in it to make that repair. Is that correct?
Yeah, in the future, after they already have financed this current repair that they're placing in an easement on town property, so they've already established financing for that through their organization. This will be another hopefully 50, 60, 80, hopefully never. Beyond that, should they ever need any kind of a repair to the collection system on their private property.
Got it. Mr. Bruder?
I'll try not to go out of order this time, seeing as there's only one. Sorry, Town Clerk. Move effective October 24th, 2022, to authorize Ryan J. Aylesworth, Town Manager, to execute the attached community sewer system operation and maintenance agreement between the Water Pollution Control Authority of the Town of Mansfield and the White Oak Condominium Association, Incorporated.
Seconded by Ms. Berthelot. Is there any? None. All in favor, raise your hand. Passes unanimously. We need to thank you, Mr. Bruder.
I move that the Mansfield Water Pollution Control Authority recess as the Mansfield Water Pollution Control Authority and reconvene as the town council.
Is there a second? Berthelot, all in favor, raise your hand. The town council is back. The Water Pollution Control Authority is no more for tonight. Moving on, the next agenda item is new business item E, the proposal to schedule a public hearing regarding accessory dwelling units and parking opt-out pursuant to Public Act 21-29. Mr. Aylesworth.
I'm actually going to turn things over directly to our Director of Planning and Development, Jennifer Kaufman, who's with us.
And before you start, Ms. Kaufman, just a reminder that this is just to schedule a public hearing, and we could have a
Correct.
very further and in-depth discussion at that hearing and afterward.
Excellent. So I think Ryan outlined it in his memo, what we need to do here. There are Public Act 2129. It has a lot of things that have to do with land use and what towns can and cannot regulate. One of those is accessory dwelling units. So in order for the town not to adopt the state requirements, there has to be a meeting by both the Planning and Zoning Commission and the Town Council. So what we're looking to do for you to do tonight is to schedule a public hearing to hear comments on both the accessory dwelling unit component of that, and as well as the parking standard component of 2129 to see if you would like to opt out.
Thanks. Is there a motion from page 208? Mr. Bruder.
Move effective October 24th, 2022, to schedule a public hearing for 7 p.m. at the Town Council's regular meeting on November 14th, 2022, to solicit public comment regarding opting out of standards for accessory dwelling units and parking pursuant to Public Act 21-29.
Seconded by Ms. Berthelot. Any discussion? Bruder.
Only to say congratulations on your new position.
Yes.
Thank you.
Very much so. Any other discussion? If not, let's vote. All in favor, raise your hand. Motion passes. We will hear much more about this at our public hearing on November 14th. I would encourage counselors to take a look at the memo from the Teiche Planning and Policy Group to the PZC on page 237 and 238, so you get a good understanding. Okay, next is item 8G, which is a proclamation in honor of Mansfield's veterans. Mr. Aylesworth, do you want to introduce the topic? This is a proclamation for the Human Services Departments.
Yep, it's an annual tradition of the town council to adopt a proclamation in honor of Mansfield's veterans, and such a proclamation was adopted again for this year. It appears on page 273 of the packet, largely similar in form to previous year's proclamations. And this year, so there will be a luncheon at the Senior Center on November 4th, which is a week from Friday. And at that event, the mayor will read this proclamation, so it'll go into effect on November 4th.
Anyone like to make the Cotton? Lots of doctors on the council.
I
better
move
remember.
effective October the 24th, 2022, to authorize the mayor to issue the attached proclamation in honor of Mansfield's veterans.
Is there a second? Seconded by Ms. Berthelot. Is there any discussion? Ms. Cotton.
I'd be remiss as a veteran if I didn't thank the town council for putting this initiative forward. It's very much appreciated by all veterans.
Any other? No, let's vote. All in favor, raise your hand. Passes unanimously. Okay, that has gotten us through our new business. The next item on the agenda is reports of council committees. The Finance Committee has not met. So personnel, Mr.
We
Sharon.
have not met.
And committee on committees?
I think that the topics on the agenda that we covered fully report our actions.
All right. Anything on departmental and advisory committee reports? Anything on petitions, requests, and communications? Anything for future agendas? Ms. Berthelot?
I love all things about slowing down traffic. I'm hoping at some point that we can talk about this traffic calming idea for the traffic circles as proposed tonight.
I can assure the council that this topic will garner a lot of attention and focus throughout this year's budget cycle.
Mr. Coleman?
Yeah, tonight's public comment about the roundabouts. Maybe we could bring in the appropriate staff, and did we not do a traffic study or traffic audit? Perhaps we could see that as well.
Yep, we can include, there was a road safety audit for sort of the downtown portion of 195, and then the section of 275 from Separatist Road to the intersection of 195. And while that report has been shared with the council, we can certainly provide a little bit of a summary of that report as part of these other discussions.
Thank you.
Anything else for future agendas?
I would maybe just note here, so we are exploring, as you know, we've had some challenges. I've had some challenges finding a date and time that works for all members of the council for the goal-setting retreat. And so no decision has been made. I want to talk with the mayor when she's back, get her take on this, but we'll be exploring, I think, the possibility of perhaps front-loading the business items in November to the first meeting, and or moving some of them to the meeting in December, and perhaps using the second meeting as November as a goal setting. So the regular council meeting that occurs on, would that be the 28th, I guess? Maybe using that night as a goal setting meeting. My hope had been to kind of schedule a separate time, get folks out of this room. It may actually still be a different location. It will, of course, be a publicly noticed meeting, open to the public that wants to attend. But just, I know you guys put the regular council meetings on your calendars, so it seems to be the second and fourth Mondays of the month are kind of the only nights that I know you guys are scheduled to all be available, so that may be the best thing to do, even if it wasn't the vision going in. But I will talk to the mayor and we'll plan accordingly.
If that's it for future agendas, then we have an executive session, so motion as outlined in your agenda, inviting Ryan and Attorney Weinstock.
And our interim Human Resource Director, Lee Palmer, who's here as well.
Ah, yes, and him. Mr. Bruder?
I move the town council into an executive session in accordance with Connecticut General Statute, Section 1-206B, for the purpose of strategy and negotiations with respect to pending claims.
And to invite?
And to invite the town manager, Attorney Weinstock, sorry, and our interim HR director,
Lee Palmer.
Lee Palmer.
Is there a second? Second by Mr. Coleman. All in favor, raise your hand. It passes unanimously. We will hang in recess until the Zoom is shut down and folks can clear the room. Thanks.